So good evening, everyone, once again. I think some more are yet to join, but we will not, will respect your time and start with this session on time. It's already 8 o'clock. So as mentioned earlier also, we are going to discuss the second topic of discussion today, and that is understanding the basics of communication, which is more to do with your day-to-day communication with your patient, which includes basically verbal and non-verbal communication at length. So before we go further, I want to show you two videos. These videos fortunately have been done by Indian doctors in Indian context. So I'm sure you will be able to relate with both the videos very well. The first video is like how we normally, interact with our patients. And then the second one would be a better version of the same. I would request all of you to have your copy and pen ready. And when you are viewing the video, please note down something that you think is not appropriate in the first video. And also, certain behaviors are absolutely non-negotiable. And in case if you notice something like that, so you're requested to make a note of it, and then when we have discussion, you'll be able to talk about those points. And of course, in the second video, I would request you to note down what do you think is appropriate or what do you think was done well, and your own impression about the video. So let me quickly share the screen with you and start with the first video that I want to show you. I hope the screen is visible to all. Okay.
Next. What? Doctor, my leg is swollen and painful. Since when? For the last 5-6 days. What were you doing? Why did you wait so long? This looks pretty bad. Doctor, I thought the pain was just a strain in the leg. Anyway, what do you think now? You could have waited for some more time and we could have amputated your leg. Leave it. What's your sugar level? It is under control, doctor. The fasting was 140. When was it done? What was your HbA1c?
Dr. Ravi, I think you have some challenge with the video.
Yes,
Dr. Ravi, I can hear you. Are you not able to hear the video voice? Dr. Ravi, is there some challenge at your end? Can you hear me, Dr. Ravi? So am I audible to everyone? Okay.
Yes, ma'am.
yes, ma'am.
Dr. Ravi, you
Yes,
can.
ma'am.
Dr. Ravi, maybe you can log out and log in once again. Please log out and log in once again. I'm sorry, I had to pause the video because I saw his message that he was having some challenge in the video. I think I'll call him and ask him to log out and log in. So we'll have to wait for 30 seconds for Dr. Ravi to log out and log in. Good evening, Dr. Haq. I'm not able to hear you. I think there's a challenge with your audio also. Dr. Ravi, I think you will have to take help from somebody from your, somebody who can assist you with your audio. Because when you log in at that moment, you have to click the button for the device audio.
It was 4-5 months ago. Actually, HbA1c is an expensive test, and I was feeling all right.
I can't understand. You do investigation according to your will. You don't take proper treatment. You don't follow our advice. I don't know why you need doctors. And you come up with all sorts of complications like this. And what did you do with your leg?
I went on a pilgrimage to Sabrimala, so had to walk barefoot. I might have injured, I think.
Barefoot? Hello? Yeah. Who? The patient Ram, HIV positive patient. So he doesn't want CT scan. So tell him if he wants treatment, he needs to undergo CT scan. Like, what does he think of himself here? Prime Minister or President? See, discharge him against medical advice and tell him not to come to this hospital once again. Okay? Yeah, bye. And you got this boon. I'll tell you, if you go once again, you will also go near the God. Didn't I tell you about the foot care when you came last time? Huh? And your smoking is continuing without interruption, I guess.
I have reduced a lot, doctor. I am smoking only 1 or 2 cigarettes a day now.
Can't understand your attitude here. You do smoking, you are overweight, you don't take medications, you don't do investigations. I don't know what to tell you.
I'm trying, doctor. And if you don't want to see me, I could consult someone else.
See, whatever I'm telling is for your good. I don't know how to tell. I gave you information leaflets last time and you're not following my advice. And if you don't want to see me, it's fine with me. I have got enough work to do. I've got enough patients to see. Sister, please call the next patient.
Maybe some of you have seen this video earlier. Have you? No. You're seeing it for the first time. Okay. Because this video is made by Bangalore Baptist Hospital, and they are the one who actually took lead in conducting master trainer program in communication to start with. I'm talking about 2010 or something. So I'm amongst the first few batches who attended their program. Now, if I may ask you, you saw the whole video. It was around 3 minutes interaction between the doctor and the patient. So it could be the doctor, it could be the nurse on duty, it could be the front desk staff, or it could be anybody who is in healthcare interacting with the patient. So if you look at the whole interaction, I'm sure you got the feel the quality of interaction was not really very good. If I may specifically ask you to identify what do you think was not right, maybe each one of you can give one point, either write in the chat box or you can unmute and speak, but stick to one point so that everybody gets a chance to speak. Just 1 second before that, Dr. Shifazo, if you could switch off your video when you are walking. There's a lot of movement in the camera, or maybe you are in the car and the car is moving and that's why it's. So if you can, for the time being when you're in travel, if you can switch off your video, and once you are in a place where you can sit down, you can have your video on. Yeah, so I can see some of the messages coming in, like Dr. Sudarshan says, privacy of the patient breach. Absolutely. Janvi says no empathy. I agree with you, Janvi. Harsh tone by doctor. No doubt, I think it was clearly visible. What else? What about others? What do others say? No proper greeting. Yes, Farha, I agree. He just forgot to smile. What about greeting? He even forgot to smile. Yes, Dr. Deepika, no eye contact. And doctor was looking at some paper. It could be patient's file, but patient doesn't care for that. The moment the patient comes into our visual field, and if we don't make eye contact, they feel that they don't exist for us, and that's very insulting for them. Yes, multiple interruptions, blaming the patient for being careless and not being responsible, not making patient comfortable. Yes, I agree with you. Not caring, avoiding eye contact. Yes, no eye contact. Yes, Dr. Rajesh, sarcasm. True, very true. You could sense sarcasm actually throughout his communication. And then doctor not waiting when the patient is saying, or not waiting to complete, allow the patient to complete. Yes, assumption that you are still smoking. Yes, no confidentiality of the patient and not telling goodbye. Absolutely. Not appreciating patient. Yes, Deepika, I agree with you. If you are a smoker or if you are into alcohol, it's very difficult to leave these things. Forget about smoking and alcohol, tea and coffee. We are all so used to taking. And if I ask you to take, little less tea or coffee, even that can be very challenging for those who are in habit of taking a lot of cups of coffee and tea. Of course, alcohol and smoking, we all know that they have their own addicting factor, and then people find it very difficult to leave. So if somebody is trying to do something, we have to encourage that person to see if that person can do. Absolutely. I think you have covered almost every point that
I think I thought that the doctor was full of attitude and very pompous. He said, no, that if you don't come, I have got a lot of patience.
Absolutely. I think you really nailed it. Not excusing when he was answering some phone call. Yes, I think that's another. Yes. Again, when the patient used HbA1c, or the patient said that I couldn't get it done. I mean, see, it may be just 300 or 400 rupees test, HbA1c. For us, maybe it's nothing. For a patient who is earning, say, 500 rupees a day, it's almost like full 1 day's, salary that goes into the testing. So patient may not get it done. I think you have covered almost every point that we observed in the video. And you can see, if you will overall look at the video, this is how very often you will see in a government setup. In private setup, the doctor may not be this rude. Verbally also, he or she may not use this insultive language, but then the body language and the tone of voice, we all know that could be very, very similar to what we have seen. So I think we have all covered almost everything, points that I wrote. Yes, then the moment patient came in, he did not make eye contact with the patient. Expression on the face did not show any connection or any willingness or any desire to connect. After all, patient may have waited outside maybe 30 minutes, 40 minutes, and if it's a government setup, sometimes even 2 hours, 3 hours. And that patient will be with you for 2, 3, or 5 minutes. And if you do not make enough eye contact, if you don't make any connection, patient feels disconnected. Patient feels that I'm not wanted or respected or not desired to be here. Then, of course, if you saw the way he offered the seat to the patient, he did not verbally say, please sit. He just showed his eye and said, sit. So this behavior we don't give to people whom we consider equal to us. So that showed that he was disrespectful towards patient. Of course, he was busy seeing patient's file. But then how do patients know that my file is being seen? So that means initial eye contact is very important, at least for those 10-15 seconds when the patient enters your visual field and you ask them to sit and make them comfortable. And then if you say verbally, Give me a minute, let me have a look at your file. Just this one sentence is more than enough to make your patient comfortable. Okay, my file is being seen, so it's okay. I can wait. But if you don't speak up, how will the patient know that my file is being seen? Then, of course, he was rude, he was full of attitude. What was his opening sentence, if anybody noticed? What was his opening sentence? What?
What? Yeah.
What? और अगर मैं हिंदी में बोलूं क्या है? Something like क्या है? Why are you here? Instead of saying what, if I say yes, please tell me how can I help you? और हिंदी में अगर मैं बोलूं तो मैं हाँ जी बताइए क्या काम है? हाँ जी बताइए कैसे आना होगा? The whole conversation quality will change with just use of appropriate word. Then of course he commented about HbA1c. He made fun of patients' religious beliefs. When he said next time if you go barefooted, आप ऊपर चले जाएंगे. We'll go directly to God. I mean, how unfair it is. And we all know, I mean, we all go to Vaishno Devi, we see people walking barefoot, we see people going to temples barefoot. Maybe they have their own spiritual beliefs and faiths, which we cannot make fun of. And of course, all the time you made the patient feel that you're not good enough, you're not complying, you're not, good enough. Now imagine if this is the way I'm talking to my patients. This is one odd patient who received this scolding from me or this misbehavior. But if I'm seeing, say, 20, 30 patients every day, and with all my patients, if this is the way I interact, what will be the state of my mental health? And at the end of the day, how happy I will be after doing my job. You can well imagine. Of course, the patient also must have gone home very disappointed from the quality of interaction. So it is not what you say, it is how you make your patient feel. So in these 3 minutes, he made his patient feel, you're good for nothing. You don't look after yourself. You are a problem to me. Why the hell have you come? Let's watch the next video and see, could he have interacted in this way?
I felt it was more like a teacher reprimanding the student for doing something wrong. Not a doctor-patient relationship, kind of.
Because that's the way initially, doctors would talk to their patient. But fortunately, at that moment, patients had a lot of faith and respect for the doctors. So actually, they never felt bad, even if the doctor shouted at them. I still remember when I was a kid, I'm talking about almost like 40, 50 years ago. My mother used to take me to a pediatrician if we fell ill. And he was very rude, but my mother will still go to him. No, he's a good doctor. With one day medicine, you all become fine. So we are going to him. So never she talked ill about him or felt bad about his behavior, because overall she knew that the intention was very right.
Very good, yeah.
So maybe he was trying to be more like father or more
firm,
like
very firm about certain things. Yeah.
But the intention was very clear to make sure that the patient and the family follows the instruction. But today we know that that kind of respect and that kind of relationship we have lost. So we really have to be careful when we are interacting with our patient. They will see this as insulting behavior or offending behavior. So now let's see the next video. Could he have interacted in this manner? Okay. I hope the slide is visible.
Next. Hello, Mr. Kannan. How are you? Please take your seat.
Thank you.
What can I do for you?
Doctor, I think I have a problem with my leg.
What happened?
4-5 days back, I went to Sabrimala and I had to walk barefoot for some distance.
Mhm.
I'm very scared now because my leg is swollen and painful in the last 4-5 days. And I think I did a stupid thing by walking barefoot.
Let's see what we can do. Good that you realize the importance of foot care. Meanwhile, how are your sugars?
Actually, my fasting sugars was 140, but it was some months ago. I was feeling all right and I didn't do the HbA1c. It is so expensive, you know.
It is expensive indeed, but it is so important to get the investigations prescribed by the doctors, because otherwise it's very difficult to give the treatment, you know, and treatment may not work as well. Anyway, can I examine your leg?
Yeah, sure. Sorry, sir. It was my mistake. I didn't do the test.
Hello? Yeah? Yeah. Excuse me for a moment. Yeah. What's the name of the patient? So he doesn't want the CT scan, right? Yeah. Try to explain to him the importance of CT scan. Yeah. When I come for rounds, I will also tell him. Okay. Thanks for informing. Thanks. Bye. Sorry about that. You got infection in your leg. So how are we doing regarding the quitting the smoking?
Regarding smoking, it's doing good. Actually, I brought it down to only 1 or 2 cigarettes per day now, doctor.
That's good. But total quitting is very important. See, if you have reduced from 1 pack to 1 or 2 cigarettes per day, quitting that is also not very difficult, you know. And how are we doing regarding the exercise?
Yeah, going on, but I must admit, not so regular.
See, exercise and diet are as important as your medicines, if not more. But for the time being, you need admission for sugar control and control of this infection. Is it okay with you?
Whatever you say, doctor, you have to cure me this time. And hereafter, I will definitely take care of myself. This will not happen again.
Yeah. We need to control your sugars and control the infection. Otherwise, it may go for gangrene and may lead to further complications. Now, the sister will go through the procedure and admission process. Okay. And meanwhile, you have this leaflet and you can go through it, which will help you to follow the regimes. Okay. Thank you very much.
Thank you so much, doctor. It was so kind of you.
You're welcome. Thank you.
If you observe the length of both the videos, the second video actually took shorter. And imagine these.
Next.
Oh, sorry. This is still on. Give me 1 second. Just keep it on. Sorry. Yeah. So if you saw the quality of interaction, it was very professional, to the point. And even if the patient had not got the test done, and this is very common, compliance across the world is around 30%. Patients would normally not comply with what you write, but you can choose whether you get annoyed about it or you just put the responsibility in the patient's court and say, it's your health, you need to look after. And in case if you don't do it, you will be responsible for what is happening. But we cannot be rude or insulting to the patient. And overall, see, he was quite respectful. He greeted the patient well. He offered the place to sit. He heard his patient very well. And then at the end, both of them were actually smiling. I think that's the most important part, that at the end of every interaction, if you are satisfied, if your patient is satisfied, every drop adds to the ocean. At the end of the day, you can well imagine how would you feel if that's the quality of interaction you have with your patient. So it's not just with your patient, though I've taken this specific situation where you are interacting with your patient, it could be with your staff also. It could be with your patient's attendant. It could be with the front desk staff or with your technicians or anybody whom you are interacting with. So you could be a quality person who is not actually interacting with the patient directly, but you are definitely interacting with your staff. So do you really take care of this part that you are interacting with your patient is qualitatively satisfying for both the parties? And one non-negotiable behavior in the previous video, can you remember? Can somebody tell? Please unmute and say about the first video. Non-negotiable behavior. Can you recollect?
Patient confidentiality.
Yes, absolutely. We do this. We stand around one patient and we talk about the other patient. अरे उस patient का क्या हुआ? अरे उसका जिसको टीबी है, अरे जिसको कैंसर है, अरे जिसका HIV पॉजिटिव निकला है, उसका क्या करा? So what we are doing, we are talking about that patient. We are in escalator, we are in corridor, we are in cafeteria, and we talk about other patients without realizing that others are overhearing that, and that's breach of contract. Patient's confidentiality is our responsibility. Earlier, probably nobody cared, but today, it's a serious offense. And if you will look at the number of cases in the Western world, a lot of cases are around breach of confidentiality. So time is not very far when we will also be in kind of similar trouble where we patients sue us for the breach of confidentiality. So I hope these two videos give you a fair idea about how communication fails and how it can be made better. And these were all small, simple, two videos. So today's session is all about understanding when we communicate what all we need to be careful about. Any idea what percentage of communication decides your personal and professional success? Any idea?
99%.
Why, very nice. Quite liberal in giving the importance. I fully agree with you. Any other guess? %? Okay, Dr. Vara says 80%.
75%.
75%. Again, quite a good guess, I would say. So there's a study by Harvard. That study tried to evaluate the importance of communication skills and interpersonal skills in handling our patient. And it found out that 85% of our professional and personal success actually comes from our communication and interpersonal skills. And I mean, it's very surprising, very shocking, but incidentally, do we really give that much of importance to the communication skills and interpersonal skills, if I may ask you? I don't think. Do we really put in as much effort to learn these skills in a systematic manner? Again, I think you will agree with me, not really, because it's just assumed that we all know, we know how to talk, there's nothing to learn, so we can do it. But actually, it requires proper inculcation of these skills right from the beginning. So actually from the school time itself, we should bring in these skills among kids, but especially for the professional programs, it's very important that these skills are integrated right from year one. Of course, now medical colleges have integrated EdCom module where the students are being taught about attitude, ethics, and communication in patient handling. But it's a long time by the time we'll actually be able to see these things in the actually having an influence on our quality of interaction. Just 1 second, there are a couple of chats. Yeah, there are good days and bad days with patient interaction. Yes, Dr. Ravi, I completely agree. That's because when we are interacting with our patients, not being very mindful of the quality of interaction. But once you will be mindful of it, you will actually be able to make a good use of every opportunity where you send your patient satisfied, where you make sure that your staff is satisfied with your communication, your team feels happy interacting with you. Dr. Kapoor, can I request you to switch off your video because you're moving and it's actually causing movement in the, thank you so much. Yeah. So once you sit at a place, please have your video on. Yeah. So if I may ask you, what do you see in this picture? What do you see in this picture?
Boss yelling at his subordinate.
Subordinate, or maybe wife, or maybe a client, or it could be anything. But definitely we can make out that this person is shouting. What else? Anger, yes. I can see angry person. Yes. What else? Showing anger, absolutely, showing anger. See, we haven't heard a word, but still you are so accurate in your guessing that this person is angry and is shouting on somebody and is really, really, he's showing that he's superior. See, even this we are able to read from the video. That's because 93% of your communication is non-verbal. Can you believe this? We normally put lot of emphasis on the verbal communication. So we make sure that the language is good. We don't use any wrong words. But unfortunately, most of the communication does not happen through words. It's through your tone of voice and your body language. So we communicate actually through three ways. Like I said, language, paralanguage, and body language. Language is the words that we use. Paralanguage is the way we deliver these words. And body language is the facial expressions, eye contact, the way we stand, the way we sit. And we are going to talk about all three in detail to precisely understand what I should be careful about in terms of my language, paralanguage, and body language. So if we talk about language, I think we all know that we either communicate verbally or we communicate in the written form. So if I may ask you, do words matter? Do words matter? Yes or no? They matter.
Yes.
They really matter. Even though if they have 7% of contribution to make, but they definitely matter. So let's do a small activity. I want 5 volunteers from you. So please be open to the idea of participating in the activity, because that's the best way to learn and understand the nitty-gritties of communication. I want 5 volunteers. Please raise your hand. You can raise your virtual hand. Okay. Dr. Rajesh is okay. Dr. Farha is agreeing. Rashmi ji is agreeing. I've got 3 people. I need 2 more people. Hurry up, hurry up. Yes, Deepika and Dr. Ravi. Thank you so much. So 5 of you, you will have your video on. Rest of the people, please switch off your video for the activity, for the purpose of activity. Thank you. Wonderful. Okay, great. So imagine that 6 of us are going for a picnic. We're going for a picnic and we are planning, like we are sitting across a table and we are planning, okay, let's go for a picnic this Sunday. And we are discussing what and where and how. And every time we will start speaking, we will say, I'm okay with the plan for picnic, but, okay. And after but, you will have to give your own individual, whatever you want to say. So I'll make the beginning and I'll pass the baton to the next person, and then you can pass the baton to the next person. So I'm okay with the plan to go for picnic, but I have some guest coming home this Sunday. So I don't think I'll be able to make it. So I request Rashmi ji to continue.
Yeah, I plan to go for the picnic, but there could be some unavoidable circumstances or some prior commitments because of which I will not be able to join.
Okay. So Deepika, unmute your device, please. Yeah.
Yeah, so I would like to go to the picnic, but I think we have to change the plan of choosing somewhere indoor because the weather condition is not appropriate for an outdoor setting.
Mm-hmm. So you're not comfortable going out in an open place? Okay, okay. Dr. Ravi.
Sorry. Yeah, I'm okay with the plan for the picnic. But unfortunately, my daughter is not keeping too well. So if she is a little better, I would definitely try to make it. But please excuse me if I cannot. And I hope you all have a very good time. And if I don't make it, we'll definitely make it up. I will make up my absence
Thank you
in
so much.
future.
Thank you. Dr. Nair.
I would like to go to picnic, but my wife is not agreeing to the idea of for going to the picnic. She has to go for her shopping. So I'm sorry. Please carry on and enjoy yourself. I have to look after my home minister. Sorry.
That's perfectly all right. Thank you so much. Thank you. Dr. Farha.
I'm okay with the plan, but on that day, my daughter is having her birthday party. So if I can ask her if she agrees to celebrate her birthday on that day outside with all of you, then I can ensure that. Otherwise, I'm fine with it.
Okay. Thank you. Thank you. Now we will have another round of discussion, but we have to change this word but with and. So I'm making the beginning, and after me, in the same order, we will continue. So I'm okay with the plan of going for picnic, and I'll get food for everyone. Rashmi.
I'm okay with the plan, but if you would just add, sorry, it's
and,
not.
Yeah. Please unmute. I think you have muted your device.
I'm okay with the plan, and I would love if you permit that my husband too joins the picnic.
More the merrier. Excellent.
Keeping him happy also.
Thank you so much. Yes, Deepika.
I was about to say the same thing, but I think Rashmi took the lead. So anyways, I love with this plan of going out for a picnic, and I really want to bring my pets along with me because that would definitely add on some gala to my time.
Wonderful. So you can have a lot of fun with your pets. I haven't met them, so we'll get a chance to meet them. Thank you so much. Thank you. Yes, Dr. Ravi.
I'm okay with the plan for the picnic. And also, if anybody would like to travel with me, since we have a bigger vehicle, I would welcome anybody. Let me know when I can pick you up, because traveling also, the journey is also great fun.
Oh,
So
yes.
thank
Oh,
you.
yes. I wish we all can accommodate in your car, so we don't have to take multiple cars. Thank you. Thank you. Yes, Dr. Rajesh, please go ahead.
I'm okay with the picnic, and I'm more okay because for the picnic because my wife is also very happy about it, and
Wow.
she's so happy that she'll be preparing bondas also.
Wow.
For the picnic.
So she's ready to postpone her shopping?
Yes, and she's ready to cancel her shopping spree also.
That's so good. That saves you money also. Thank you so much. Yes, Farha, go ahead.
I'm okay with the plan, and I also wish that my daughter's birthday celebration is also done there.
Oh, that's so good. That's so good. So wonderful. Yeah. I think that will be really fun. Can I request everyone to have their cameras on? Share your observation, please, about both the interactions. What difference did you observe? You can unmute and speak. Maybe one or two people can unmute and speak.
Replacing the
Rashmi ji, हम नहीं बोलेंगे. हमने participate करा था ना, जो observe कर रहे थे. I want them to. Of course, I'll ask you to speak, but I want the observers to speak. Okay, Janvi has sent a comment. Let me read it. Okay, second one had more positive responses. Absolutely. The first video was expressing doubt. Okay, yes, the first interaction was expressing doubt and negative communication. Absolutely. I completely agree. What do others say? Dr. Huck, what do you say? What was your observation? Unmute your device, yeah.
My observation is on the second video, we are showing positiveness to our friends so that we can enjoy the picnic well.
Absolutely. Now imagine if every interaction happened in this manner. Imagine the quality of the outcome. Yes. Isn't it? Very positive. But a lot of us have this habit of using if and but. Sometimes unnecessary if and but. You will bring in remotest possible obstacle that can come in the way of being successful. We see this happening all across the day. We have people around us who are just there to find fault, who are there just to say no, who are just there to just talk about something that has a remotest possibility, but that will just bring hurdle to the situation. Now, just connect with yourself for a couple of seconds. Try to recollect one sentence that you often use, or something that you think or you say, which you think is inappropriate and you think that creates negative energy in the workplace, with your patients, with your family, or with your colleagues. Try to recollect and write that one sentence in the chat box. And we all have one or two sentences which we often use. Very right, Farah. Be careful, you may fall in trouble. Imagine if we are using it too often, probably we are creating more fear than actually instilling confidence in the person. Oh my goodness, Dr. Huck, I'm so thankful that you are writing this. You are not giving your best. Your intention must be very right because you want to encourage the person to give their best. But imagine when you say you're not giving your best, that means you are not good enough or you are not giving your 100%. Cannot talk now. Okay, if you are using this too often, I agree this can be very detrimental. You are inefficient. Yes, Rashmi, I agree with you. Though I don't say it much, you are a God case. Even said once is enough to kill the person, Dr. Rajesh. Oh my goodness, Dr. Deepika, you put me down or I can't trust you. Again, very, very sad. I mean, when we say, imagine somebody using this for us. Now read this sentence and imagine that somebody has said this to you. I think it will kill your confidence. It will actually completely destroy your confidence in yourself. Quite often, use, but with no, absolutely. I don't mean that your intentions are wrong. Intentions are never wrong. You are going on wrong way to achieve your goal. Again, Sharvano, if it is, even if it is said with a good intention to tell the person that you are not doing it right, it can actually make the person lose confidence in oneself. I hope I have read everybody's, okay, don't argue with me unnecessarily. Again, Dr. Ravi, when I say something like this to my team or my staff or my nurses or my kids, next time they will not feel like honestly coming out with what they think. They may say something which is not in tune with what I'm thinking. It may be another perspective and I may not agree with it. But to you, it might appear as an argument. To us, it might appear as disagreement, which is not true. It could be just that they are just saying what they want to say, and it may not match with what we are thinking. Thank you so much. I think we got a wonderful response, and I think now you have an idea. Sometimes even unknowingly, we do sometimes things that can damage somebody's confidence completely. I remember I was in a bank with my husband. I was sitting in the bank manager's office. There came a girl. She was around, must be very, very young, 20, 22 years girl. And this girl had brought some work to show to the bank manager. The bank manager was also not very old, must be within 40 years, 35 to 40 years. And probably she had made a mistake in the work that she had done. The way he shouted at this girl in front of us, I could literally see tears in her eyes. Who gave you this job? Who gave you this job? You're not fit for this. I could see her confidence, falling down like melting ice. And we do this, higher we go, more liberty we take, more rude we become, more blunt we become, and sometimes more insensitive we become. And that's all in the name of somebody's welfare. Intentions are right. I don't mean that. That's what we say. I didn't mean that. I just say it. I didn't realize that I'm doing. So sometimes mindlessly, when we make some statement, they can actually do more harm than doing any good. So it's very important. Words play a very big role. So we have to really mind our language. Words do matter. And I think this activity has shown us how that matters. Similarly, with our patients and with people with whom we are, I'm sorry, this is tough. Why is it tough? Okay. Yeah. So now you can recollect the common errors we make with our juniors, team members, patients, their family members, our own family members. I think we saw some examples in the chat box, and there's a realization that we do make such mistakes. So the common errors you will see across, especially in the healthcare, we use sometimes disrespectful language for patient or their family member, and for our juniors, because we assume that we can take that liberty, especially words like tu and tum for our juniors, and also for people who are younger in age. We think it's more like, being more closer or being more personal. In today's time, the moment you will use this word tu and tum, even for your own children, they will not like it. They may point out, but how can you use this word? Please use aap for me. And they don't like it. At times we become rude, authoritative, and uncourteous, thinking that I'm senior, I'm the boss, they are junior to me, they are much younger to me, I can take that parent figure, but not, right? That's not helpful. Your team will not align with you. We also snub them by using foul language. आपको इतना भी नहीं आता, किसने दे दी आपको नौकरी? पेशेंट अगर ज्यादा सवाल पूछते हैं, हम एकदम से बोलते हैं, भैया आप सर्जरी करवाने आए हो कि मेरी नॉलेज चेक करने आए हो, or something like this. So when you snub like this, they may become quiet, but they also will become disconnected with you. And sometimes we become rude in the name of assertion. We think if I am frank, I'm blunt, I'm open, I'm asserting. I think this misunderstanding has to be clarified. We are going to devote a good amount of time in understanding what assertion is, because I believe this is one communication skill which each one of us should be thorough with. And if you are able to take this skill from this program, trust me, the quality of your interaction with everybody around you will change, because your way of handling situation will be very different. So we will talk about this at length when we talk. And also sometimes we forget the basic courtesies. For example, how many of say, excuse me, I need to take this call to our patient? Do we ever say? I don't think. Sometimes, if you're doing, I'm very happy. I'm very happy. But most of the times we think that I have all the right to take the phone call. At the same time, in case, unfortunately, patient's phone rings, how aggressive we become and how badly we shout at the patient. बंद करिए भैया, आपको नहीं पता कि बेल नहीं बजनी चाहिए, आप दिखाने आए हो, मेरे को बाद में बात करना. So phrases like thank you or excuse me, we don't use for our patients and juniors very often. But those of you who are doing, I really, really appreciate. Another common mistake that we do when we are interacting with the patients, especially, we use a lot of technical jargons. I think you will agree with me. So if I show you the next slide, I had developed writer's cramp, actually, and had gone to the orthopedician to show, and then he sent me to the neurologist. He said that you will need, injection botox. This was the explanation given to me. So to you, to some of you, this might appear, this is very simple. I mean, there's nothing difficult to understand. But suppose if the same explanation is given to a patient who is a lay person, who is not well versed with these terms, for them it can be very, very difficult. So Dr. Ravi, I think you have asked a very interesting question, not question, rather you have said, ma'am, every patient's phone rings when I am examining them. This will happen. So what is the way? One, I can put 2-3 big posters at a place. Please put your phone on the silent mode in the clinic. That's one thing. You can even instruct your staff to remind the patient कि सर अपना phone उस पे कर लीजिए, साइलेंट मोड पे कर लीजिए, बिकॉज अंदर जाकर आपका फोन नहीं बजना चाहिए. I know. See, let me tell you, we are trained doctors and healthcare professionals. Patients are not trained patients. So we have to find a way. So you will have to find a way. I know it's very, very annoying. Nothing works. Then I'm reminded of this, who's that? Shivani, sister. I don't know how many of you listen to Sister Shivani. So Sister Shivani says in a large program, a lot of time, or audience will not put their device on the silent mode, and suddenly the phone rings. Now you can choose to be angry, or you can just smile, or you can ignore. So similarly, for example, sometimes I see some of your devices are on unmute mode, and there's a background, voices coming. Sometimes you keep your video on and then you walk around, and then we see that movement happening across us. I can choose to be angry, I can choose to ignore, or I can choose to politely say, can I request everyone to put their device on the silent mode? So you will have to find a way. I mean, I know you are nodding and you're saying nothing is working for you. That means you will have to go out of the box and find out solution for it. And we'll talk about it. But yes, they have to be repeatedly reminded to put their phone on silent mode, because it's not, comfortable to attend. 1 second, I think there's somebody who's trying to join. Yeah. So the whole idea is, if we are using a lot of technical jargons with your patients, they will not understand. So we have to really use the language that the patient can understand. Now, coming to the written communication, this is one of the summary shared with one of my participants of the last batches. Can you see the error in this? Can you see the error in this? Somebody's device is on. Can I request you to put it on the silent mode? Yeah. What error can you see in this?
It is not legible.
Okay, that could be
the scroll like kind of handwriting.
Okay. What do others say?
Can't make head or tail of what is written.
Absolutely. It's not written in order. I fully agree, because that's the way most of us have learned. There is no formal training in writing patient's summary or case sheet. There are protocols. There are protocols of writing patient's case sheet or summary or referral sheet. But honestly, there is no formal training. Medicines are not written in capitals. Absolutely, Janvi, you are spot on. I think this is what I was waiting to hear. No name. Did you notice that there is no name of the patient? Forget about the other details about age, sex, ward, whether CGHS or non-CGHS or MRD number. Just imagine, we are missing the basic information. And if you give this to the patient, and this is a real document that I'm showing with you, not like I have created this. So similarly, we all know language is a big problem. We write in cursive handwriting. We use a lot of abbreviations that are not standard abbreviations. Yes, I can read Dr. Huck's message. Patient's information lack, cannot read properly. It should be in all caps. Yes, written with pen and everyone cannot know what is written there. Yes, Shervano, I agree. That means the information has to be put in some order. We should know. Plus medicines now, they say that you have to write in capital so that there is no error, because most of the medication errors are prescription errors. So therefore, it's very important to make sure that the prescription is written in a manner. When you write prescription, please remember this is going to be used by the patient, or the person who's going to dispense the medicine, or the person who is going to maybe inject or give the medicine. That means doctors are going to write, Either the nurses or the pharmacist or the compounder or the patient is going to actually use this document. So when you're writing this, you got to really know who is going to use this. Are they able to read what I'm writing? So things like case notes, prescription, referral note, progress note, nurse's note, operation note, we write day in, day out. But how many times is it in proper format? Is it legible? Is it complete in itself? Is it signed properly? And is it dated and timed? Because now it's compulsory that you write, when you write something, you have to not only sign, but you have to also write the date and time. And I don't know in other hospitals, but I know about tele-government hospital. Now they say once you sign, you have to actually stamp it with your name. Because usually when people sign, they sign in such a manner that nobody can make out who has signed this document. So that means now they're asking that you have to sign, you have to stamp only then. Yes, SNDT format. Absolutely, I agree with you. I agree with you. I can see one more reply. Sign, name, date, time. Thank you, Janvi, for adding that. SNDT. I think that's a new this thing acronym that you have brought in. Thank you for that. So that means, and this is another, somebody sent me this patient's OPD slip. Now imagine what is written. Can you actually read anything? Can you really understand anything? So the common errors that you will see, mostly either the handwriting is not legible, the writing skills are not okay. Very honestly, let's admit, English for some of us is not our first and second language. It could be even third language for some of us. So naturally, the writing skills, because they are not taught, they are not learned. So many of us, not even spoken English, even in the writing, we are not good at. Using abbreviations that are not standardized, overwriting or cutting is very common. Done but not documented. A lot of time people will say I've done it, but it is not documented. Documented but not done. This also you may have seen in your practice. And then documented, not signed and not dated. And of course, language is a common barrier, because if you don't know the exact words, you may miswrite something. So these are the common errors you will actually come across when you will see patients' documents, and a lot of errors happen because of this. So according to several HIM experts, the top 4 documentation mistakes are: one is mixed messages from a physician, while there was misunderstood dictation or illegible handwriting. So it's a very common problem. Then misuse of copy and paste. So a lot of time we copy paste without checking whether this message is accurate and well fit in the message. Of course, then incomplete or missing documentation. Things are not written properly, or it's incomplete. And then of course, misplaced documentation when it's not being written. So that was briefly about the language part. Moving forward, the second communication, or the second part of the communication, which is very, very important and which is quite substantial in terms of its contribution, it's paralanguage. What is your understanding of paralanguage? What is paralanguage? What do we mean by paralanguage? Language is words. Paralanguage is how you deliver these words. So paralanguage is all about your pitch, volume, rate, quality, intonation. Do we really care for this? Do we really bother to check the quality of our tone? Do we really check, is my volume okay for the patient to understand what I'm saying? So all that has a huge contribution. 10% of the conflicts are because of the wrong words, but 90% of the conflicts are because of the wrong tone of voice. At times we are rude, and at times the communication goes haywire when we don't use the right, tone of voice. So this one sentence, I want some of you to try your hands to say in different tones. Let's understand. Try. Did you give her that medicine? Try, unmute your device and speak. Did you give her that medicine? Try using different tones and speak.
May I?
Okay, go ahead.
Did you give her that medicine?
Okay, good attempt. Somebody else?
Did you give her that medicine?
Did you give her that medicine? Okay. Somebody else?
Did you give her the medicine?
Did you give her that medicine? Again, a question. Have you given her that medicine? Thank you. Any other attempt?
May I?
Please go ahead.
Did you give her that medicine?
Now you see, there's one sentence and we have heard different versions, and every time the version and the intent changed, although the words are same. So similarly, if you put little emphasis on one word, the word that I have underlined and highlighted, the complete meaning of the sentence will change. You can read it for yourself and you'll get an idea. So somebody comes in and I say, Aye. Instead of saying like this, I say, Aye. I've used the same word. Change the tone, the whole intent changed. Roko mat, jaane do. Roko mat jaane do. I changed the position of pause, the complete meaning changed. In public dealing, tone of voice plays a very big role. A lot of time, people can see insult and offense in our tone of voice. आप ऐसे कैसे बात कर सकते हैं? आप बात कैसे कर रहे हैं मेरे साथ में? Because the tone of voice is intimidating or rude or offending. So in public dealing, we got to remember that we have to be careful to sound friendly, confident, and non-aggressive. Because it is not what you say, it is how you say. The whole meaning changes if your tone of voice is not sounding friendly, inconfident, or is aggressive. A lot of time we become aggressive. I think that's something we have to really remember. So appropriate use of pause, slowing down when you want to put emphasis on something, increase or decrease the volume to emphasize or highlight a point, and at the same time, keep it professional and friendly. That's what we have to always remember when we are dealing, in public dealing. A lot of time we are very soft. That happens. A lot of time we are very soft. If you are too soft, what happens? What do you think will happen if you are too soft in your tone of voice? What will happen?
Ma'am, if we talk very softly, then the person, we may, firstly, the other person who's listening to us may not understand if it's a very soft tone, may not be taking us seriously if it is a very serious matter to be conveyed. So the tone has to be appropriate, ma'am. It can't be harsh, it can't be very soft also.
Absolutely. I fully agree with you. If you are too soft, the biggest risk is you are not heard. You are not heard in both ways. One, hearing, and then one, listening. And on both grounds, you will lose because people will not take you seriously. People will not, care for your words. I completely agree with you. So I can see some answers in the chat box. You will not be understood. Yes, Dr. Shafazo, I agree with you. You will not be clear because you are not audible. Yes, Dr. Janvi, I agree. Patients may not understand because you are very soft and not audible. People will not pay you attention. Absolutely. You may not be heard in both ways, either in intention and also the auditory hearing, and not highlighting the importance. Yes, nobody will listen to you. Absolutely. That's what I'm trying to say. So that means I have to be firm, audible, confident, but at the same time, I don't have to be rude. So being soft but audible and confident is very important. How about ill effect of using rude or harsh tone in a workplace, with especially in a public dealing place? If I may ask you, what is the risk of using, high pitched tone or shouting in the workplace? Yes, I agree. Dr. Shafazo says the doctor will not be satisfied. If you shout, that's what you're saying, Dr. Shafazo?
No, if we are so soft.
Okay, if you're soft, then naturally you will not be happy because nobody will listen to you, so you are unsatisfied. Absolutely. Okay. A lack of respect. Yes, there is a risk of lack of respect because people will actually take you, oh, this person is shouting. So it appears very professional. We don't get respect. Yes, Farha, I agree with you. I think you are also saying the same point. So once the incident has passed, it makes you feel terrible. Can you elaborate on this, Dr. Ravi? Can you unmute and
Yes, ma'am. We always have the patient's best interest at heart. And sometimes, we are little firm. We are, like you were talking about your pediatrician. I mean, I have been so many years in practice. I started out being very stern. And, sometimes then you feel, once the patient has gone, at the end of the day, that are we, empathy is so important. And it is not just the treatment.
Absolutely.
So, the patient might recover from the illness, but,
The
that
connection is
personal bond is gone.
gone. Absolutely. I think you're spot on. Wonderful. So I can also see some good answers coming in. For example, Tanvi says you'll become unapproachable. Yes, people will be scared of you, especially if you are a team leader and you have people under working with you. They will never be honest, open, and comfortable with you because they'll always be scared that you are rude, you are unapproachable, you can snub them, you can shout at them. So they'll try to stay away from you. The doctor will lose her business. Absolutely. I think that's very important. There was a time patient took this behavior with a pinch of salt because they never doubted the intention of the doctor. But the younger generation, trust me, before they come to you, they actually look for the reviews for you. And in case your reviews are that doctor is rude, doctor is very misbehaved, they make you wait, the staff is very uncourteous, that patient, not only that patient, no patient will come to you. 75% of the patient footfall is because of the word of mouth your patient spread about you. That's the importance of sending your patient satisfied. So I agree with you, Dr. Shafazo, the patient will lose her business. It creates bad image about oneself. The patient will not come again. Absolutely, I agree. If you shout, but if you get shouted back, you will lose respect. Yes, that's another risk. Today, patients don't mind insulting you, giving you back. There was a time they would not at least say you anything. They may not come back. At the most, they'll go and write bad reviews for you. But today, they can start fighting and arguing with you. And then, of course, it creates issues with patients and patient dependent as they are in pain. Yes, they are disturbed. They are badly affected. They feel bad that we are acting insensitive. Then, of course, doctor will not reach to good diagnosis. Yeah, if you are not able to get all the information from your patient, you will not be able to make the right diagnosis for your patient. And in terms of staff interaction, people will not be transparent and open. Absolutely, I agree with each one of you. The biggest risk that I want to, bring to your, awareness is the risk of violence. Now, I want to just give you two situations and you will agree with me. Take one situation, the patient is misbehaving. Patient is misbehaving, patient is not, behaving in a courteous way. But you are behaving well, you are professional, you are firm, but you are not, misbehaved or rude or arrogant in your approach. There are people around you who are observing you. In this situation, whom do you think public will align with you or with the patient? With us, absolutely. Because they can see that you are not being, bad mouth, you're not being rude, you're not being arrogant. Patient's family members might even say to the patient, आप कैसे बात कर रहे हो? आप इलाज करवाने आए हो या झगड़ा करने आए हो? वो इतने अच्छे से आपको समझा रहे हैं, आप उनके साथ लड़ने को पड़ रहे हो. Public will come in your favor and stand कि भैया आप बाहर जाके लड़ लो, डॉक्टर साहब तो इतने अच्छे से बात कर रहे हो और आप कैसे बात कर रहे हो? Of course, you will less often see this kind of a situation now. Take second situation. Patient is misbehaved and you are also very arrogant, rude, and bad mouth. Now tell me, with whom will the public stand? With the patient. And that often happens, The biggest risk in being aggressive in public is people will come together and they'll stand against you. Please remember, mob psychology is very different from individual one-on-one interaction psychology. In mob psychology, they will just unite. Each one of them will feel that you are the one who is actually creating trouble, and we are all victim of the situation. So there's a victim psychology, that we are deprived or we are victim, we are sufferer. Then they will unite together and they'll become revengeful. People, those who don't know each other, even they will, come together and fight and argue and break your furniture and other things. So in public dealing, I think it's very important that we learn that we should not use aggressive tone and aggressive behavior, because that can be very, very detrimental. So one should be very, very careful about it. Another thing which also plays a very big role is the speed of our talking. Some of us actually speak very fast, very, very fast. And you may have seen this actually. I can see some answers if I can take that. Yes, a doctor will become a celebrity on Facebook. Dr. Haq, yes, but in the wrong manner. Celebrity in the wrong manner. Yes, situation will go out of control. Absolutely, I would. Yeah. Especially if you have misbehaved with your patient. So I was talking about the speed of talking. See, if you are an eye specialist, or you are a dermatologist, or you are a surgeon, you know your subject well. The terminology that you use every day, you know about those terms, retinal vitreous, vitreous hemorrhage or nucleus drop. All this is something so common for you, so you know what exactly they mean. But if the patient is listening to you and the patient is not familiar with that terminology or vocabulary, they will not be able to understand. A lot of time, our speed of talking is very different from the understanding speed of the patient. So we have to be really careful about the speed of talking. Please match your speed of talking with the understanding speed of the patient. Otherwise, there will be a mismatch. So that was about little bit about the we missed one slide. Sorry. Yeah. And last point on paralanguage is assertion. Of course, I will be discussing this at length in the coming sessions. But just to bring in here, I think this is one thing that we all have to learn. Please, in the name of becoming assertive, you cannot lose courtesy. So your language, your paralanguage and body language has to remain courteous. You have to be polite and firm at the same time. I'm not saying give up or give in to what patient asks for. But again, don't use foul language or foul tone of voice. And this you will be learning through role plays. We will be doing a lot of role plays. And I'll be giving you demos also around it. So you will get an idea how to stay firm, still courteous, and not lose your composure. We'll be talking about it. So this is one skill, as I said earlier also, everybody should learn it, and should practice in your day-to-day communication. So that was about language and paralanguage. Now we are going towards body language. Again, 55% of the communication happens through body language. So when you enter an office, suppose you have gone to a government office for getting something done. I mean, looking at the person's face, I think you are able to kind of guess, will this person help? Will this person listen to me? Will this person attend to me? Will this person do my work? Am I right or wrong? Mostly we are able to guess. Now look at these facial expressions. Oh, we do an interesting activity before we go further. So your body language speaks more than your words. Your action speaks more than your words. Yes, Dr. Ravi, you want to say something?
Yes, ma'am. Sorry to keep interrupting so often.
No. It's not
Oh,
interruption. I think we look forward
okay.
to this interaction.
Okay.
Please go
You
ahead.
know, ma'am, one very terrible practical problem is that ever since we've started wearing masks, our patient hardly sees our face. And I think it's a big drawback.
Absolutely.
They cannot,
I completely agree, and that can be compensated by making sufficient eye contact. And if you are able to make good eye contact, because eyes are very expressive part of our face. So it's very important to lock your eyes with the patient for a couple of seconds so that the patient can see that you are looking and you are also listening. So this can be compensated. And of course, eye contact we are going to talk about. So we are going to do a small activity. All those who have their cameras off, please have your camera on because we are going to do an interesting activity. And the activity is action speaks louder than words. Thank you. So I'm going to take you to your childhood. एक बहुत अच्छी सी poem है. If you are happy and you know, touch your nose. Am I right? सबको याद है? कोई बात नहीं, मैं बोलूंगी और आप मेरे साथ में उसको साथ साथ बोलेंगे, ठीक है? और उसमें हम क्या करेंगे? If you are happy and you know, touch your nose. और जब मैंने कहा nose तो आप nose touch करेंगे, उसके बाद में 3 times clap करेंगे, ठीक है? मैं एक बार डेमो देती हूँ, फिर आप मेरे साथ चलेंगे, ठीक है? If you are happy and you know, touch your ear. If you are happy and you know, touch your eyes. If you are happy and you know, touch your chin. ठीक है? Everybody with me? तो अपने हाथ खाली कर लीजिए सब लोग. Be ready. Everybody. बचपन में जाना है, बिल्कुल बचपन में जाना है और easy. Yes. Thank you. Okay. So I'm going to do it and you're going to do with me. ठीक है? If you're happy and you know, touch your nose. If you're happy and you know, touch your ear. जल्दी करो भाई. पहले ear touch करना है, फिर clap करना है. If you're happy and you know, touch your chin. मेरे साथ साथ करना है. If you're happy and you know, touch your nose. How many of you were about to touch your ear? I saw a lot of you. Because although you were listening to me, you were actually following my actions. Similarly, when we tell our staff to behave well with the patient, to be respectful, to be caring, to be compassionate, to come on time, to do your job well, to not to attend phone call when the patients are around, they don't listen. But they follow your actions blindly. If you want your staff to come on time, you start coming on time and you will see you will not have to tell them. If you want your staff to keep their phone on silent mode, keep your phone on silent mode. You will not have to remind them to keep their phone on silent mode. If you want your staff to behave well with your patients, start behaving well. I can give you a live example of what happened with me. I think that I put that on LinkedIn. I don't know if some of you read that. I think that example must have gone to thousands and thousands of people. I was coming from US in the first week of July last month. So on my return, actually I had a writer's cramp and I also developed some problem with my back. So I was wearing a belt and I was also wearing a glove for the writer's cramp. So I had requested for a wheelchair, which I got promptly at Orlando airport. So once I reached New York, where I had to change my flight, I requested, once I got out of the flight, I requested the air hostess, ma'am, can you please request for wheelchair for me? Because I will not be able to lift my baggage. I can walk, but I cannot lift my baggage. She said, I'll ask it. So in the meanwhile, the captain was coming out of the cabin. So he came out and he saw me standing with the glove and with the belt. He said, don't worry, I'll send somebody. I said, fine, thank you so much. So he went out till the gate. So it was like around 300 meters from the aircraft till the gate. So in 2-3 minutes time, I see this captain coming with the wheelchair. And he said, "Ma'am, बैठिए." I was shocked. I didn't expect the flight captain to bring wheelchair for me. I said, no, it's okay. Please don't bother. I can wait for the assistance. He said, it's all right. Please sit. He made me sit and he took me to the gate. His air hostesses were literally clapping for him. Can any one of us do something like this to set an example for our staff that when patients come, can we go extra mile to send them satisfied and happy? Especially when they need us or need our care, need our attention. If you want to really set examples, you have to be a good role model. If I ask you not to shout, and if I shout 100 times in my class, people say she's just teaching us not to shout. Look at her behavior. Yes, absolutely, Dr. Joshi, lead by example. That's what is the need of the hour. So whatever changes you want in your staff, start practicing. You will not have to say, you will not have to speak. Unfortunately, we think we are exempted of that responsibility because I'm the boss, because I'm senior, because I'm more educated, because I'm higher in hierarchy, because I'm head of the department, because I'm a doctor. If you are a doctor, if you are a head, if you are in charge, then the responsibility of being responsible is all the more. Even at home, if you want to inculcate any behavior among your children, you have to first practice and demonstrate. And then you see, you will not have to teach anything to your children. If you don't want them to smoke, you will have to quit smoking. If you don't want them to have alcohol, you will have to stop taking alcohol. If you don't want them to disrespect women or misbehave with people, then you have to demonstrate that respect. And then you will not have to verbally tell them that this is what is expected from you. So as I said, action speaks louder than words. So work on your actions, you will not have to use any words. Now coming to the next slide that I want to talk about, and that's about our facial expressions. As I said, body language includes, rather, let me first tell you about what all includes in body language. Facial expressions, eye contact, gesture, posture, touch, space, everything is part of body language. I can see a message. Let me just quickly have a look at the message. Lead by example. Thank you. Yes, agree. Yeah. So if I talk about the facial expressions, look at this slide. Usually what is our expression when we are interacting with our patients or their family members? 1, 2, 3, 4, 5, 6. Write the number in the chat box. There are 9 facial expressions. Which is the usual facial expressions we keep when we are interacting with the patients. I'm looking for some more answers. I've got 3 answers and everybody says 5. Dr. Rajesh says 1. Yes, sir, at 9 o'clock, and especially if we like the person, then it is 1. Even Dr. Sudarshan Joshi says 1. Absolutely, Rashmi says 1. 1 and sometimes 2. Most of you have said 5, which is actually correct. Most of us keep this expression. And what is this expression, by the way? Can you write in the chat box? What is expression number 5? What do you see in this expression? Yes, Shivraj, that's only when you want to smile at the patient, but mostly we are so occupied. Yes, no expressions at all. Blank face, neutral, blank, neutral, no expressions at all. Absolutely expressionless. If you were received by a doctor or a nurse or a front desk staff with these expressions, how will you feel? Will you be happy? And especially if you are paid, say, a fee of, say, 500 rupees or 1,000. Yes, Shivraj, I think you have brought in a beautiful point. Shivraj says, to be honest, we are trained here to keep smile at all time with patient. Okay, so if you are trained, but again, am I doing it genuinely, or it is just an expression that I'm doing? A lot of time I hear doctors saying, we keep this expression for a reason. What is that reason, if doctors can comment? Why do we keep this face? You can unmute and speak. I think one of the doctors can unmute and speak. Why are doctors taught to, yes, compassion. Thank you, Shivraj. Thank you. Why are doctors trained to keep these facial expressions of number 5? Because a lot of time we hear, this is what we have been asked. क्या कहते हैं मिस्टर हाशिम, आप क्या कहते हैं? क्यों एक्सप्रेशन देते हैं हम ये वाला?
Ma'am, generally, sorry, I'm interrupting in between, ma'am.
Ji, please go ahead.
I don't think, ma'am, in our MBBS curriculum, we are always taught to be courteous to the patients, especially when we see our superiors or seniors interacting with patients.
Mm-hmm.
So this might be, number 5 might be just a normal routine for quite a few people. But ideally, if you see many of our doctors, they are having a smiling face only, like majority of them. That is my take on it. But number 5 is fine, but it gives a very neutral sort of facial expression. But there's nothing like training part of it, that we are told or we're asked to look like this.
So very recently, there was a discussion on LinkedIn. Dr. Rajesh Jain, who's a pediatric surgeon, he had brought this up, that about the expression and also the emotional connect with the patient. If we have expression number 5, which to some it might appear as neutral, but to some it might appear as disconnect. So I think I have been emphasizing on one thing, that if you want to communicate with your patient, and if you want to cure the patient, and if you want to win the patient, most important is to connect with the patient. So if one has this expression number 5, the risk is that the patient will feel disconnected. You may be keeping this expression with the idea that it is better not to express any emotions so that the patient does not get disturbed. Some people, like Dr. Ravi said, to appear serious, especially if the patient is in pain. I know if the patient is in pain, we will never smile and laugh. We are quite sensitive and sensible that way, that we will not smile or laugh. But in a lot of situations, the patient is not very serious. Patient has just come for treatment. But definitely, if I'm keeping this expression of number 5, the patient might feel that I am doing it mechanically. That's the risk. But if Dr. Rajesh, if you say that your doctors mostly are smiling, I'm very happy to hear this. I'm very happy to hear. But I'm talking about what is the situation generally. Deepika says mostly many start the day with face number 1, but gradually by the end of the day, it changes to 5. I think I agree with you. That's what I was saying, that when we come, we are smiling, but then because we are not caring for ourselves, we get exhausted, the petrol goes down, the energy goes down. So we become, kind of neutral and kind of unconcerned. So maybe we think that number 5 is safe because while interacting with people, it is safe for us, agreed, but it is unhelpful. It is unhelpful. Okay, Mr. Hashim says, so that the patient can finish the discussion in short. Very often, we keep this expression to keep the patient at distance so that the patient does not speak much. And if you don't feel like smiling, then stop for that day. But then we do work and we don't smile. So I think one thing that we have to remember, smile can actually change the milieu. I mean, if I had taken the whole session with the expressionless face, by now you all would have been bored and tired of me. It's very important to smile. If you smile, your own inner self also remains calm and cheerful. It's not just for the patient. For us also, we need to smile to stay happy and to feel cheerful. So our facial expressions like anger, irritability, unhappiness, attitude, everything is actually visible. Much before you speak, patient can make out, will you talk? Will you behave well? Will you listen to me? Will you agree with what I say? Will you help me? all that is, they are able to guess. Yes, Dr. Huck, I agree. Seeing 80 to 100 patients in OPD per shift, difficult to keep happy face. I completely empathize with what you are saying. But still, we see some doctors staying calm and cheerful. I think I would stop sharing here and I would like to answer this question because this is something very important we need to address. I completely agree. When you start your day, you are cheerful, you are happy, you are light mood. But as the day goes on, we start losing our composure and our energy. Therefore, it is very important to look after your health. Couple of things, if all of you start looking after, actually you can stay cheerful throughout your interaction. Please note down these things. If you're already doing, be very happy about it that I'm looking after myself. If not, start looking after. One, sleep. 6 to 8 hours of sleep is must. Please do not compromise on sleep. Sleep is a biological need. All your mental and physical wear and tear takes place during sleep. So if you are not sleeping enough, one day's grudge is getting accumulated. Second day, it's going to double up. Third day, it's going to be 3 times. So you can well imagine how are you going to feel in terms of energy. Second is food. 3 meals a day means 3 meals a day. Please don't skip your meals at any cost. Don't give me this reason. I was busy, I was sleepy, I was in a hurry, I left my breakfast. Please take 3 meals a day. Take 2 short, quick bites in your bag. It could be some nuts, it could be a soft drink, it could be a juice packet, it could be, anything. It could be a fruit, something that you can quickly eat. I always keep a small packet of biscuit in my bag or small packet of nuts in my bag. When you don't have anything, just take a fistful of nuts, gulp it down. You will instantly have energy. Mostly when we lose our composure is when we are actually hungry and tired. If you're doing your job well, in between, if you take 2 minutes break and take something, maybe juice or a fruit, nobody's going to say you anything. You put your car on the highway without petrol, you are bound to go fuelless. Third, look after your emotional health on a regular basis. Sit with yourself, talk to yourself, ask yourself what is bothering you. If there is anything at home or at workplace disturbing you, please, please, please address it. Do not take it for granted that it will automatically get resolved. Things do not resolve. Only thing is they get brushed under the carpet, but they may pop out at the wrong point. Create good network and support system at home and at workplace. That gives you a lot of strength and energy. That gives you a lot of feeling that there are people around me. Please have good team of people working with you, around you. You will never get a ready-made team. Teams have to be created. Create an environment where people feel supported by you and you feel supported by them. Of course, yoga, meditation, exercise, they are all very important. Attitude of gratitude is very important. Address your concerns on regular basis. If there's something that's bothering you, you can change it, go ahead and change. If you have bought a wrong pair of shoes, it is not fitting you well, please throw it. It's okay. It's a wastage of 1,000, 2,000, 3,000 rupees. It's worth the wastage. But there are things you will not be able to change, like the life partners we have, children that we have, place of work, what we choose, we cannot change immediately. So a lot of things will have to be accepted. So when you accept, it doesn't mean that you are becoming passive or you are becoming silent, but you are saying it's okay. Nothing can be perfect. Nobody is perfect. Even I'm not perfect. So when you accept things, you start working on it with a fresh mind. And then in case if you are not able to accept, if you are not able to change, then rise above the situation. So sometimes when you look at the situation from a spiritual perspective, problems look very small. They become just, they lose their importance in your life. So there are so many ways to deal with this situation. Change the things that you can change. In my life, a lot of time when I try my best and I'm not able to change, I have actually, kept one word for myself. And that gives me a total, serenity. And that is Hari Ichha. खुदा की मर्जी. जब पूरी कोशिश कर ली और चीजें नहीं बदल रही हैं, मैंने पूरा एफर्ट लगा लिया, इसका मतलब है ये उसकी मर्जी है, ये मेरी मर्जी नहीं है. उसकी मर्जी के सामने मेरी मर्जी की क्या बिसात है. So that's how you have to create peace with your life. But if you can change, please go ahead and change. किसी के साथ कॉन्फ्लिक्ट है, बात करिए, अपोलोजाइज करिए. अगर आपने कुछ गलती करी है, गो एंड से सॉरी. जूनियर है, सीनियर है, सबऑर्डिनेटेड, डजंट मेक अ डिफरेंस. सामने वाले से गलती हुई है, बात करिए, उसको समझाइए. give that person a chance to explain their position. Forgive and forget. Let go. घर पे हम करते हैं, अपने बच्चों के साथ, अपने हस्बैंड वाइफ के साथ करते हैं, वर्क प्लेस पे नहीं करते. हम कोल्ड वॉर में चले जाते हैं, इश्यू बना लेते हैं, दूसरे को नीचा दिखाने के लिए पूरा एफर्ट करते हैं. इट विल नॉट वर्क. वर्क प्लेस इज वेरी इंपॉर्टेंट. प्लीज रिमेंबर, एक्चुअली आपके सारे प्रोडक्टिव आवर्स आपके वर्क प्लेस पे जाते हैं. घर पे तो हम खाना खाने आते हैं और सोने जाते हैं. सो वैल्यू योर रिलेशनशिप एट वर्क प्लेस एंड यू विल सी अ चेंज इन योर एनर्जी. तो आपको 100 पेशेंट देखकर भी थकावट नहीं होगी. अपने स्टाफ को ट्रेन करिए, डेलीगेट करिए, उनको जिम्मेदारी बनाइए, so that you all work as a team. And there are so many ways. I think every doctor, every healthcare professional must learn management. बिना मैनेजमेंट सीखे आप नहीं कर पाएंगे प्रैक्टिस. Gone are the days when you had one clinic, one patient, one table with 10 medicines and you were running your clinic. इतना कॉम्प्लेक्स है हेल्थ केयर डिलीवरी सिस्टम. मैनेजमेंट सीखे बगैर आप लोग कर ही नहीं सकते. Everybody should undergo some management program so that you are equipped with the management skills. So this was in brief about how we can handle very difficult situations in spite of the heavy workload. So अपनी team create करिए. So what I'm trying to say, in your body language, most important is your facial expressions. Especially जैसे आप कह रहे हैं कि मास्क लगा होता है, अगर मैं स्माइल करूंगी, एक्सप्रेशन इस पे रख के, मेरी आंखें फिर भी बोलेंगी कि मैं स्माइल कर रही हूँ. पर अगर मेरी आंखों में एक्सप्रेशन ही नहीं है, तो मैंने मास्क लगाया हुआ है, तो और भी डरावनी लगूंगी, और भी ज्यादा आई विल अपीयर डिस्टेंट. So it's in your hand whether you still want to lock your eyes with the patient and smile. बहुत बारी ऐसा होता है, पेशेंट हमारे सामने खड़ा होता है, हम कुछ लिख रहे होते हैं, खड़ा हुआ व्यक्ति खड़ा रह जाता है. पेशेंट या जूनियर या हमारी टीम के लोग हम उन्हें बैठने के लिए नहीं कहते, हम उनकी तरफ देखते नहीं. I was taking a program on this Tuesday at AIMS Jammu. So I asked one of them कि अगर पेशेंट आके खड़ा हो जाता है तो आप क्या करते हो? उसको बैठने के लिए भी नहीं कहते, बाहर जाने के लिए भी नहीं कहते, तो क्या कहते हो? She said कि I don't make eye contact. How uncourteous is that? She said if I make eye contact, I have to reply. Why not say 2 मिनट बैठिए, मैं ये काम कर लूँ, अभी आपसे बात करती हूँ. और why not say बैठिए प्लीज, मेरे हाथ में जो काम है मैं करके आपको अटेंड करती हूँ. But sometimes we do not make eye contact. In healthcare, making eye contact is all the more important. Can somebody tell me why? Why is it important to make eye contact in healthcare?
It gives reassurance.
To build trust.
Absolutely, trust, reassurance. What more?
Ma'am, that's the first step in communication, ma'am, having eye contact with the other person.
Absolutely. And if you will go to some of the hospitals, doctors don't make eye contact. Front desk staff do not make eye contact. Nurses don't make eye contact. Interns will go and take blood sample. They will explain the discharge slip, but they will not make eye contact. This is very common because we don't know how important it is to make eye contact. Actually, if you will make eye contact, you will actually be able to observe the patient. Patient झूठ बोल रहा है, सच बोल रहा है, घबरा रहा है, डर रहा है. All that you will be able to get to know if you make eye contact. And of course, the answers that you have given, that it will instill confidence, it will win patient's trust. Patient will feel I'm being heard. The person who is attending to me is listening to me. Patient will feel hopeful. Yes, absolutely. So it's very important to make eye contact with the person. And it also shows that you are attending with complete 100% attention. Of course, there's a protocol about eye contact. In personal setting, you can look at the eyes and below the eyes. But in professional setup, it is eyes and above the eyes. Also, Do not look at the patient for more, not only patient, with staff and with everyone. Do not look at the person for more than 2 to 3 seconds. Look at the person, change the focus. Again, look at the person, change the focus. घूरना नहीं है, सिर से पैर तक तो बिल्कुल नहीं देखना, because that makes the other person uncomfortable. Posture, इसमें 2 posture दिख रहे हैं, A और B, कौन सा ओके है? कौन सा ओके है? A और B? Yes, if it's okay, गलत भी होगा तो क्या हो गया? हम कौन सा कोई टेस्ट ले रहे हैं? B is okay? Okay, most of the people have written B. 2 लोगों ने लिखा है B. Okay. Okay. Actually, दोनों ही okay.
I would say none. Because the first one shows a very casual thing, the A one, I think.
Absolutely.
And the second one, there's probably a disconnect, like sort of, when you fold your hands and you sit, unapproachable kind of
Absolutely.
posture.
Thank you for saying that. So when you lean forward, occasionally nod, that shows that you are listening, you are interested to listen. On the contrary, if I'm sitting like this, or if I'm moving like this, rocking in my chair, that shows that I'm not attentive to you, I'm not interested in listening to you. So we got to be very careful about the posture that we have, especially when the patient is talking about something very serious, maybe about a death in the family or a serious health condition or some financial issues. We got to be very careful about the posture that we make. Okay, touch again plays a very big role. And we all know that touching in healthcare is unavoidable. We need to touch the patient when you're examining the patient, injecting the patient, you are physically examining the patient. So on one side, touch can communicate empathy, understanding, and concern. On the other side, the patient may feel uncomfortable, and because it's not comfortable to let anybody, touch you. So one has to be really very careful before you touch the patient. So what challenges do you foresee in touching the patient? What are the different challenges that you can, sometimes some patients do not like to be touched, especially by the opposite sex. If it's a female patient, she may not want to be examined by a male doctor, or vice versa also. So I think one thing that we have to remember before we touch the patient, we should, yes, depends on the culture. That's what I meant. In certain cultures, it's not considered, appropriate. So I think most important is before you touch the patient, before examination, please signpost. Please say, I'm going to check your eyes. I'm going to check your throat. I need to check your back. I need to check the. There's a concept of implied consent. We all think if the patient has come to the OPD, patient has come for consultation, there is an implied consent for physical examination. My dear, implied consent, patient does not know. So we will have to tell the patient, I need to examine your back. Are you okay with this? The answer will invariably be yes. But when you ask, you are kind of giving this choice to the patient to say no. And if the patient says no, then you will have to find a way, what do I do? So, of course, you have to establish rapport, like Dr. Ravi has written, only once we have established a rapport, we should touch the patient. Yes, take permission with smile and care. Exactly, that's what I meant, Dr. Haq, that if you tell the patient and give the choice to the patient to say no, patient will most likely say yes, because they also know that to get treated, they need to be examined and they are okay with it. But it's important, signpost and then examine the patient. Of course, we all know that soft touch on the shoulder or on the arm goes a long way in actually communicating your compassion and care for the patient. But we got to be careful. We all know that it can create misunderstanding. We need to be careful when you're touching the patient, especially if the patient is of opposite sex. Please be careful not to touch the patient unless you have really built an excellent rapport with the patient. Yes, Mr. Hashim, I completely agree. Patients can feel the intention. So we got to be very respectful, especially your technicians in lab, in radiology and ECG. There you have to really train your staff to touch the patient with respect and care. Little rough touch, they can immediately make out that we are being disrespectful, or they may even doubt our intention. So very important to kind of train the staff to be respectful. Hand movements is also part of body language. Sometimes certain hand movements can be very offending, and we got to be really very careful. For example, when you do like this, what can I do? It can be taken.
Ma'am, sorry for interruption. What was that signpost before touch? What does that mean?
Signpost means verbally saying that I'm going to do this.
Okay. Okay.
So you
Thank
have
you.
verbally told rather than immediately, you start touching the patient. Even if you need to touch, check the pulse.
Pulse.
You'd be saying, I need to check your pulse. Can you? So
Oh.
99.9% patient will be saying that I'm okay, but it's always good to ask. Yes, I think gender problem, Dr. Mr. Fazo, I agree with you. That's what I'm saying, that there can be misunderstanding, especially with the opposite gender. So hand movements, like for example, this hand movement or this hand movement can be misunderstood, and the person might feel offended that you have been disrespectful, especially with, or sometimes we say chaliye bahar and we show our finger. They don't like. Even when you're talking about their disease, it is not a good idea to point that part of the body where the disease is. They don't feel comfortable. So we have to be careful when we are using hand. So this is in a nutshell about the language, paralanguage and body language. Now something about our dressing, the way we conduct ourselves, even that communicates. For example, in this picture, whom does he look like? Does he look like doctor? And would you have believed? So it's very important to dress up appropriately for the profession. Because if you want to win your patient's trust, if you want the patient to come for treatment, stay with you, you've got to have that image. So sometimes people argue on this, that why the hell should we be dressed up in this manner? Let's remember, people treat you the way you look. If you look like a doctor, especially for the young doctors, I always emphasize that please dress up appropriately in a smart doctor attire so that you look like a doctor. Otherwise, at times, because a lot of time, very young girls especially, they would say, ma'am, sometimes patients call a sister, and we don't like it, because I'm a doctor, I would like to be called a doctor. So you have to look like a doctor, you have to dress up like a doctor. So it's very important to remember that you will be treated the way you look. If a doctor is dressed up I have seen this happening, especially in government hospitals, interns and residents sometimes will come in their bathroom slippers, or will be wearing a very loose, jeans and t-shirt, not appropriate. In public places, people are observing us. They are observing our conduct. The way we sit, the way we stand, everything is being observed. The way we even dress up. So it's very important to remember the kind of clothes that we wear, even the colors that we use. I think in a hospital setup, it's always good to use subtle colors, soothing colors. So these bright colors are okay. In your personal life, you can wear anything. But when you are in a profession like medicine, profession like healthcare, we got to make sure that we dress up appropriately, because most of the patients are suffering, unwell. So they feel a disconnect when we are overly dressed up. Or I know most of the people don't do it, but sometimes I see this among young doctors, wearing very bright colors and some, funky prints and funky design. So that's where I would like to make a mention. Now, another point that is also part of nonverbal communication, and that's personal space and privacy. We all carry a bubble around us, and we like that bubble to be respected. Anybody coming closer and entering the bubble makes the person uncomfortable. But incidentally, in healthcare, we need to go closer to the patient. If you have to examine the eye, if you have to examine throat, if you have to examine teeth or ear, you are actually in the bubble. So patient can be very uncomfortable. Again, I think signposting is very important. Otherwise, in general, a safe distance of 2.5 feet is good enough. In personal relationship, we can go closer, but with patients, with their family members, a safe distance of 2.5 feet is a good idea. Another important point that patients really value, and that is this we have talked about: seek permission before touching and signpost before you do. Yeah. Another important point that the patient really value is respecting their privacy and their confidentiality. Now, this is one picture shared with me by one of the participants of the previous batches. This patient is being is being used as a display item, and probably it is health minister and some hospital staff who are look at this patient. Imagine what this patient must be feeling. Am I a display item? So a lot of time we actually, stand around the patient, 4-5 of us, and discuss about the patient. It makes the patient very uncomfortable. So we got to really respect patient's privacy and confidentiality and not, invade it. Also, valuing their time, use of time and patient's time and valuing their time is also an important aspect of non-verbal communication. So when you make your patients wait and you ask them to come again for a small thing which can be done in the same visit, or when you make them wait and then you say, sorry, we can't do it today. I know in most of the private setup it doesn't happen, but it does happen at places. Sometimes they've come to collect report. We are not able to locate the report, and we say, please come again, or please wait, I'll attend to you later. By the time you will give the report, the consultant must have gone by then. Or when you can make the patient wait and reduce the number of visits, it's better to give them that opportunity. So valuing patient time is another aspect of non-verbal communication that I respect you. The idea is there has to be a display of respect and care at every point of contact. And that shows that we are actually caring for you. So it's not just language, it's not just paralanguage, it's not just about the body language, it's overall conduct, overall way of handling that leaves the patient with the impression that I am not a burden or I am not unwelcome. Some of the non-verbal behaviors that we sometimes show knowingly or unknowingly, and that is when people are talking to us, we start looking away, or we'll start staring, or we look sarcastically. Sometimes we close our eyes. We use unpleasant tone to snub the person, or we start playing with the phone, or we start exchanging messages or writing something or walking away. That clearly shows that I'm not interested in listening to you. So one golden rule that I can recommend to each one of us is, please don't give the behavior that we don't like to receive. I think if we follow this one rule, because we all know what are etiquettes, we are all educated, we all know what are good ways of dealing with people. Only problem is to certain people, especially like patients and our juniors and people who are lower in hierarchy. For them, we think they don't require or they don't deserve courtesies or good behavior. Till the time we consider them as human being, as equal to us. See, we are doctors, nurses, paramedical staff, everything is okay. But much before that, we are human beings. Their human need and your human need is no different. Their pain and your pain is no different. Their suffering and your suffering is no different. Their need for respect, love, compassion, care, concern is no different than yours. And if you treat them with respect, everything will work. I think that's one golden rule that I would say each one of us need to practice with our staff, with our patients and their family members. There's a part of it still left. I know I'll be covering this in the next session, in session 3, because it's already 3 minutes to 10. And I just want to give you 5 minutes time to ask any questions or to make any last comments if you have about this session. Anything you wish to ask or say about whatever we have discussed till now? Yes, Dr. Ravi, please go ahead.
Ma'am, I don't know if it's so relevant, but the last you mentioned about valuing their time.
Yeah.
And, it's not that, what I have, what I think a lot of people will experience a peak hour in our practice, where we find the maximum, sometimes it is between 11 and 2, where although you tell patients take appointments earlier, come earlier, and so there's a flood of patients at that time. And I find, there is a waiting time of 2-3 hours sometimes for patients who come without appointment. And so I I don't know the way around it, ma'am. We are nice to them, we are, but it's a it's a terribly, I can imagine the patient's frustration, but I find myself unable to, manage. And I end up eating my lunch at 4 o'clock every day because of that.
Delegation, team building, having right people on your side. These are some of the ways that I can immediately suggest you. My husband had gone for fellowship to Dr. Nagpal almost like 30 years ago, 35 years ago in Ahmedabad. That was the time he said Dr. Nagpal would have, 3-4 clinics at the same time. Patient will be worked up by the staff, and his job will be just to go and examine and then write the treatment. So if you will have people working, see, you can manage a clinic all alone if you have a certain limited number of patients. But if the patients are increasing, you'll have to work on your manpower. You'll have to have more people around you. You'll have to divide the job. You'll have to train them. I think last time also I shared with you, I met with this doctor who is in Apollo Diabetic Clinic. He said, we have diabetic nurses who have been trained to answer almost all the questions that the patient would have to ask. He says, I hardly have to answer any question because they are so well taken care of. Your time is very valuable. So instead of giving 20 minutes per patient, if you can give 5 minutes, but real 5 minutes, and rest of the workup can be done by the right people in the right manner, not that the patient will not be happy. They'll be happy that I've been given enough time and sufficient, attention. So you'll have to, again, management will come here. Learning management will come. Warren Buffett has how many companies? 67 companies. And he said he writes one letter once a year to the CEO of each company. That's all. And he then reconnects after 1 year. Delegation. You have more on your plate, so naturally it's going to spill. Thank you for asking that question. Thank you. Any other question?
Ma'am?
Yes, please, go ahead.
In paralanguage section, we had a point about the rate, the way patient understands what we are saying. You talked about that. Can you give 1 or 2 suggestions how to adjust that? I mean, what is the pace, or actually how to make them understand what I'm saying?
So in general, of course, this is one part which I'm going to cover in the second half, in the next session. But since you have asked this question, see, I think when we are interacting with the patient, it's important to, in between, check, has the patient understood? Is my language simple? Am I using enough audiovisual aid so that in case my words are not well understood, for example, I'm explaining to my patient about cataract surgery. If I explain verbally, it will be very difficult. But if I can show the model of eye, if I can show what a cataract exactly is, if I can remove that opaque lens and show that this is what is removed through phaco and this is what patient has clarity. So make your communication as simple, as easily understood as possible, so that your efforts to make it, simple becomes meaningful. Plus, about the tone of voice, in general, I mean, I would ask you to even record your interaction with the patient and hear your interaction. You will get to know where you're going wrong. A lot of us interrupt. We don't allow the patient to complete. A lot of us, we snub the patient without knowing. The tone of voice sometimes go haywire. Record your, interaction and just hear it once again and you'll get it.
Thank you, ma'am.
But this part I'm going to cover in the second half, so don't worry. We'll be talking about it again.
Okay.
Deepika has written, my key takeaway for this session as an administrator are to act, set an example and not to just preach. And communication is much more than words. Absolutely. I think these are the two major points I wanted to highlight. Be a good role model. You will not have to teach anything. People will automatically follow. So one small request to all of you. To the last session also, I received only 9 feedbacks. As I said last time also, I read each and every feedback very carefully, very, very carefully. And I make sure that in the next sessions, I address your concerns. I know all of you are very busy. All of you are occupied. 8 to 10 is a very odd time for each one of us, but no pain, no gain. I request, please take out 5 minutes. It won't take more than 5 minutes is also more, not more than 2-3 minutes to give your feedback. But your feedback will go a long way in making your program customized as per your requirement. It's not for me, it's for all of you. So I know you are very senior. Some of you may not have time. Take out that 1 minute. I'll share the feedback link in the group. Please give your feedback for the program. Also, the next session, and not just next session, all sessions from next session onwards will be on Tuesday, 8 to 10 p.m. 8 to 10 p.m. Only in one case, I will request to change in case if I'm traveling or I have full day program, because I do program for Maulana Azad Medical College for the final year students. And it's a day-long program from 9 to 5. So for me, it will be a little difficult. In case if the program falls on Tuesday, then it will be difficult for me to, come after full day standing program and then doing your program. So that will be the time I will request you to move to Monday or Wednesday. But otherwise, I'll make sure that I don't fix any program on Tuesday. On my side, I will not fix any program for Tuesday. So please keep your Tuesdays 8 to 10 free. Participate, ask your questions, whatever we are discussing, whatever points you have to add from your experience, from your expertise, feel free to speak in the program. And let's make it more interactive. I'm finding you all very attentive, very seriously, attending the program. I really appreciate that. And I expect the same commitment throughout the session. Anything for me from your side, if anybody wants to say something before we close.
Have a lovely weekend.
Thank you so much. Thank you. Thank you. Good night, everybody.
Such a wonderful session, ma'am. Wonderful.
Thank you so much. Thank you. Thank you. I really hope that each session fulfills your expectations. And also, that's what I'm saying. Give me feedback. I'll make sure that I add everything that you want me to do.
Thank you, ma'am.
Thank you. Good night.
Good night, ma'am.
Good night.
Thank you, ma'am. Good night.
Good night. Thank you, Dr. Kapoor, for joining. I know you were traveling, but still you tried to attend. But we could not.
I just landed at the Hyderabad airport and straight away I joined the session.
Thank you.
Just reached the hotel and I was there. Thank you very much. Wonderful session. Thank you.
Thank you. I'll be sharing the recording in the group so all of you can, revisit the recording and have a look. Thank you once again, everyone. Good night.